Last year we launched our campaign asking, "Is my cancer different?" This year we say yes with even more certainty. Since last year, more oncologists and patients are aware that cancer is not one disease. Cancer is a disease of many genes, and we continue to learn more about the tools we have to fight it. While researchers have a long way to go to understand all the complexity of the pathways that cancer takes in different patients, there is great hope that we are entering into an era where cancer treatment will be designed on a patient-by-patient basis rather than based on standard protocols or averages. Since last year, new, more effective targeted therapies have been approved by the FDA for the use in melanoma, breast, and lung cancer in record time. Existing targeted therapies have been approved for use in additional cancer types. New genes have been identified in lung cancer for which there are existing targeted therapies that can be used. New technologies previously only available to researchers that can identify many more molecular changes have become available to physicians for use in the clinic. These technologies have become available to more patients at lower cost. Only 3 years ago, we were able to identify a few specific mutations in a handful of genes. Now we can sequence whole coding regions in hundreds of genes and emerge with information that can be put to use immediately in the clinic. While we needed grams of fresh tissue before, now tests can be performed on smaller amounts of tissue preserved from previous biopsies and surgeries. Today, while oncologists are more aware of the importance of molecular tests and targeted treatments, there is still a lot of work that needs to be done. Today, more than a year ago, it is an enormous challenge for oncologists to keep up with the volume of information and research that continues to emerge. The ability for patients and physicians to access high-quality, reliable information about molecular tests and treatments is critical for the broad application of these new tests and treatments. In addition, the debate about how to pay for the cost of these molecular tests is critical for the widespread adoption and access for patients everywhere. In the coming years, it will be necessary to accumulate more data to prove to insurers that the cost of molecular testing is small compared to the benefits in terms of improved outcomes and cost savings that comes from getting the right treatment to the right patient in the right time. Now is the time to ask the question, is my cancer different? The answer is yes, more than ever.